Thank you so much for being here. Today we're going to be talking about gynecological conditions, and we have our wonderful guest speakers who are going to be sharing their experiences. Just as a preface, we are recording this meeting. It will be uploaded to YouTube, so if you want to turn your camera off or do whatever you need to do to feel comfortable. But yeah, I should probably introduce myself. I'm Probnor. I am on the board of IIAN, and I'm also hosting tonight with Annika. Annika, if you want to introduce yourself.
Hi, I'm Annika. I'm on the IAN committee, and I just going to do a quick verbal image description. I'm a white woman with dark brown hair, and I'm wearing a white button-down top today. And we'd ask that all of our guest speakers as well today, if they're willing to do their verbal image descriptions, that would be great.
Yes, I forgot to do mine. So I am a South Asian woman. I have a pink maroon sweater on, and I have dark black hair. So just as we mentioned, some access checkpoint things. So we do verbal image descriptions. Also, there are captions available. If you go to the bottom panel on Zoom, if you see the CC button, you can get captions through that. And if you have any other accommodation needs, please let us know in the chat and we will do our best to accommodate them. Quick disclaimer we like to provide before every session. This is not medical advice. We ask that you please consult your doctor for any medical concerns. Today we have some wonderful guest speakers. They're going to be sharing their life experiences, but each person with a condition is unique. So even amongst individuals with the same diagnosis, we really want to give that respect to that individual lived experience. And though we've done our research and we have our guest speakers today, we are not experts on these topics. So before we get into the fun, what exactly is Invisible Illness? We are a 501c3 nonprofit that's dedicated to raising awareness about invisible illnesses, chronic illnesses, and disabilities. And we also support students in starting affiliate organizations. So really encouraging students to become leaders and engage in peer education when it comes to raising awareness about invisible illnesses. And then more specifically, what exactly is the Invisibly Aware series? So that's what we're at today. The Invisibly Aware series holds 2 virtual events a month on Zoom. And so the first event typically is a presentation on the topic. And then the second event is what we're at today. And it's a guest speaker panel where our speakers really share their lived experiences. Or in some cases, we have different medical providers come and they share their professional expertise on topics. And quick social media plug, we have a bunch of ways to connect with us. So we have our Instagram for the nonprofit, and then there's also an Instagram for the Invisibly Aware series. And then we also have the YouTube, which is where this video is going to be uploaded. And we have our official website as well, iannetwork.org. And then if you scan the QR code right here, you can find a link to our link tree, which will lead you to the newsletter sign up and everything else. And if you have any questions, feel free to ask them in the chat at any time. You can message someone privately or just raise your hand. We'll do our best to answer the questions at the end. So before we really get into our guest speakers, we want to do a quick summary takeaways from what we discussed last time. So one condition we discussed was endometriosis. And specifically, what is that? It's an endometrial-like tissue that grows outside of the uterus. And how does it impact the body? So this endometrial-like tissue has been found essentially in every organ of the body outside of the uterus. And it's really diagnosed about taking on average 7 years. There is a huge diagnostic delay, but it can be definitively diagnosed by laparoscopic surgery. And so the symptoms are definitely variable from person to person. So it can range from pelvic pain. People often cite heavy periods, fatigue, cramping, lower back pain, abdominal pain, and nausea. And then the prevalence is actually estimated to affect 190 million people globally. And when we're thinking about treatment options, there's really a huge range. So the pain, of course, there's symptom management. So some treatment options can include pain management, but then there's also surgery, but there's no cure to endometriosis per se. So next, and the next condition we discussed was adenomyosis. And so This is a little bit different than endometriosis in that endometrial tissue is growing into the uterine muscle wall. And so this really impacts the enlargement of the uterus and really like causes heavy and painful bleeding. And it's diagnosed often really suspected by imaging, but it's confirmed through pathology after a hysterectomy. As I mentioned, the symptoms can really be heavy, prolonged periods. But in addition to that, there's severe cramping, pelvic pain, abdominal swelling, and fatigue. Now, when it comes to the prevalence, it is unknown, but it is estimated to affect 5 to 70% of people with uteruses. So that is a big range. But there's definitely need for a lot more research into the exact prevalence. And then we also discussed polycystic ovarian syndrome, more commonly known as PCOS. And so this is a hormonal disorder with high androgens and irregular ovulation. So this really largely impacts menstrual irregularities as well as high androgen signs and can also cause metabolic issues. So, in terms of the diagnosis, this is definitely more restrictive in terms of like what is needed for diagnostic criteria. So, it requires two of the three Rotterdam criteria, which include irregular periods, high androgens, and polycystic ovaries. So, oftentimes imaging will be done on the pelvis to examine for cysts on the ovaries. And common symptoms associated with PCOS, in addition to like obviously the diagnostic criteria, but the irregular periods, the body hair, acne, potentially oily skin, issues with fertility, pelvic pain, and fatigue. And it estimates in like prevalence wise from 3 to 20% worldwide. And just an overall kind of takeaway about what gynecological conditions are. So these are conditions affecting the assigned female at birth, shortened as AFAB, reproductive systems, and breasts in anyone with these organs. And it really can significantly impact physical health, mental well-being, and reproductive health. There's a lot of barriers when it comes to gynecological conditions and their treatment, especially when it comes to just medical stigma, medical gaslighting, and this can really be encompassed in very delayed diagnosis and delayed care. So we're here to kind of increase awareness and just foster more understanding and have a conversation because obviously there's always need for more research. And with that, it was a little bit of a long introduction, sorry. But we have our guest speakers, Stephanie Miller, who's the co-founder and co-president of IAN, along with Sarah. And we also have Ishani Vyas, I believe I pronounced that right. Sorry if I mispronounced it. And yeah, so if you both want to do like a quick verbal introduction, do like a verbal access check, and share anything you want to about yourself before we begin, that would be great.
Oh my gosh, a voice crack starting off with everything. Hi, I'm Stephanie. As Prabnor mentioned, I'm the co-founder and co-president of IAN along with Sarah. Yeah, I spend a lot of my time doing nonprofit stuff, and then I work at a hospital and working on applying to medical school this summer. So lots of things going on. And I have endometriosis. I'll do my verb image description. I'm a white woman with long brown hair. I'm wearing a light blue t-shirt, which you can't really see, and a black jacket.
Hi, everyone. My name's Ishani. Just a quick verbal image description of myself. I'm a South Asian woman. I have medium length brownish black hair. I'm wearing a black tank top that's a little bit hard to see. And my pronouns are she, her. I'll be talking about PCOS today. I'm also applying for medical school this cycle, and I'm currently working for an ENT clinic as a medical assistant.
Thank you guys so much for those introductions. We could start us off with a general question. Can you tell us about your journey? Before that, just your experience living with this invisible illness that you have, when you started experiencing symptoms, and the brief overview of this condition that you experience.
I'll start, I guess. So I started experiencing symptoms of endometriosis when I was 14, so it's been a decade, which is kind of wild to think about. I don't even know really where to start because it took 8 years for me to get diagnosed. So it was a long process for sure. So there's a lot of things that have happened along the way that I won't fully get into because we won't have the time. But yeah, I started experiencing really painful periods and just pain in general when I was 14, and it led to me missing a lot of school, being kind of bedbound, not being able to do a lot of activities. But I've come a long way since then, and I'm fully functional now, and I'm very blessed to be in the position I'm in. Yeah, that's mainly pain was the primary symptom for me, where it just rendered me unable to do a lot of things. So
For me, I think when I started paying attention to the symptoms, it was maybe 5 or 6 years ago. But if I think further back, it probably started when I was in high school. So I was diagnosed with hypothyroidism and B12 deficiency around my sophomore year of high school. And I actually remember it very clearly because I had a bunch of tests done and my doctors were trying to figure out what was going on with my body. And I had AP tests coming up and I was like, I'm stressed, I'm freaking out. It's just that everyone's overreacting. And turned out that I did test positive for a lot of these things. And I think it exacerbated the symptoms that now I associate more with PCOS. But back then it was more, okay, I'm, getting more acne, I'm just getting stressed out, or my skincare isn't working. My periods are on and off because, again, school and, applying for college and things like that. I chalked up a lot of what I was going through to different things at different times, weight gain. And then I started hormonal birth control when I was like 18 or 19, and that kind of mellowed things out a little bit, which I think was really helpful, me not knowing at the time that it was part of a treatment process or something that could be considered as a treatment for PCOS. But I think my overall experience with it has been a combination of me almost gaslighting myself. We talk about medical gaslighting a lot with, especially with invisible disabilities. And this is my first experience with it, knowing what all of these words kind of mean and hearing about the experiences of other people has been very recent for me. But I was almost convincing myself that this was something that all AFAB people go through, or many women go through. And I think that is what delayed me from advocating for myself and seeking treatment for a long time. And then after that point in the last few years is when I really have been starting treatment and recognizing my symptoms for what they are and being comfortable with the diagnosis that I've been given.
yeah, that's a great point, bringing up the stigma about it too, because I remember very clearly when I first started seeking treatment in the first place, when I was having a lot of this pain, we couldn't find a gynecologist to even go to. I was 14 and no one wanted to touch me. They're like, you're too young to be experiencing these things. You don't, you're not going to have any major issues. You're too young for it, basically, which is totally not true. Anyone who has a period at any stage, you can have any of these issues that Pabnor just talked about. So that's not a limiting factor at all. But again, like Ishani said, kind of gaslighting yourself, being like, this is normal. Like, it's normal to be in a lot of pain. That's just what being a woman is. It's just, part of the process. And that's not true. And it took a lot to get to the point of being like, yeah, I really do need help. And this is, it's confusing, especially when professionals are telling you, no, you're too young for this. You can't have any serious issues. I was actually initially diagnosed with primary dysmenorrhea, which is just, very painful periods. And it's like, all right, cool. Thanks for that. What are we going to do about it now? So, yeah.
No, definitely. And I really appreciate you both touching on that, like almost the normalization or like trying to justify to yourself that like, oh, this is something that everyone's going through, or just like like Ishani mentioned, like just blaming it on the different things going on in your life. I think that really speaks to how much education and greater awareness is needed, and like how much we just need to be having these conversations more, because I feel like even personally, just like with social media and just being in this organization, learning about these things and just having these conversations is so crucial to like being like, oh, wait, like I experienced those things. Like this is something I could maybe bring up to my doctor. Like it's so transformative to like just be able to have access to this kind of information. So I really appreciate you guys talking about that. Kind of piggybacking off of that, I know you both mentioned a little bit about your symptoms and when you notice symptoms, but kind of we're wondering in your day-to-day life since your symptoms have started, how has your life really changed since you got the diagnosis? So like, what does symptom management look like on a day-to-day basis for you? What challenges do you face in your daily life, whether that's physically, emotionally, or socially? Yeah.
So I'm very thankful to be in the position where I am now. I got diagnosed about 2 years ago now, and I honestly don't, since we started that treatment option, I'll kind of back up a little bit. So I got the only way to get like officially diagnosed with endometriosis is through laparoscopy. And so I had that surgery done. They did biopsies and they tested the tissue and it was endometriosis. I had a Mirena IUD placed at the same time that I had that surgery because that was like kind of the next step. I took oral birth control pills since I was 14, up trying different brands, trying different combinations of things. And a lot of them would work for some period of time, but then they would stop working. So it was like a constant switch every couple of years to something else. And I'm like, I'm done taking pills. Like there needs to be something else that works better. There's no way that this has to be my life, just switching pills all the time and having things stop working. They wanted to put me on Lupron. I'm like, I don't want to go through menopause right now. Like we're not going through like, different stages of stuff. So the next option was to try an IUD. And I'm like, I just advocated for myself so hard to get surgery because I'm like, if it is endometriosis, they can excise it. That helps people a lot of the time. Why would I want to just keep suppressing everything? Just get it out of me if it exists. Just, I want to do the surgery. I want to get over with it. And it took a lot of advocating over a long period of time to get that surgery, which is not ideal. But once I did get it, got the Mirena placed, after recovering from surgery and giving it some time, my body to get adjusted, periods have kind of gone away for me. I don't bleed very often at all. And if I do every few months, maybe, I have maybe a couple of bad days here and there where I'm in pain for a couple hours, which is nothing like it was before. Before I'd have like solid days of just constant pain. And it's kind of weird. I never noticed growing up until I had the surgery. I didn't know what true like uterine pain was because my whole abdomen just hurt all the time. And that's what I thought was correlated with periods. Like, oh, everyone's like stomach hurts, like their whole abdomen hurts. After the surgery, it's very focused. Like, okay, that's definitely where my uterus is located. Like, it's like very centralized, very local. And I didn't realize that it was not normal to have pain like everywhere in your abdomen. I just thought that's what having a period was. So that's kind of how, yeah, I hope I answered that question, I believe, but that was kind of a lot. So
Yeah, for me, it's been a little less than 2 years, probably closer to a year and a half. And I'm still kind of in the discovery, trying things out phase with several of my doctors, because we're also managing, like I mentioned earlier, thyroid, hypothyroidism as well. And I think what's worked best for me so far has definitely been birth control. Obviously, I don't have experience, I don't experience great pain like Stephanie talked about with endometriosis. I did have heavier periods, and when I did have them, they were few and far between, but when I did, it was pretty major in terms of bleeding and pain and all of that. Now it's more that I don't really get my period at all. Something I am concerned about, which I did learn recently as well, that I have family history of PCOS. So that was interesting to learn about from a personal side of things. But I am concerned about the side effects and possible infertility. I would like the option to have children in the future. It's not something I'm thinking about right now, but I'm sure there are AFAB people who can relate to, just wanting to have the option whenever that is, or where at whatever time. And I want to keep a close eye on that moving forward. On the surface of things, day to day, a lot of my symptom management looks like a basic skincare or beauty routine almost, because of the high androgens. My skin is really oily all the time. I have crazy acne. I grow hair in places I shouldn't. And the hair that grows out of my head that I'm used to is thinning, and it's not, what I'm used to and what I remember. So some of it is a combination of skincare and products that are just helping me look and feel better on a day-to-day basis, which helps a lot. And then keeping regular with my thyroid medication and my birth control. And I'm also discussing getting an IUD with my gynecologist. So it's kind of a mixed bag of things. And we're still kind of figuring out what's going to work and what isn't. There's also a medication called metformin that treats a lot of other conditions, but one of the most important things with PCOS is insulin resistance. So we're considering that as an option, if it may be an option for me. And then, yeah, just kind of keeping an eye on my physical appearance kind of helps me track where I am, honestly. That sounds kind of vain, but noticing when my hair and my skin and my nails and like things get brittle, or they just don't feel right, or I gain a lot of weight when I'm actually actively trying to diet and exercise, which also helps insulin resistance and things like that. So just that's kind of where I am since the diagnosis. And I think it's helped put a name on things. I'm not 100% satisfied. I don't know if anyone ever is with these kinds of conditions with where we are, but I know that it's a work in progress.
Yeah, thank you both. It sounds like this is, for both of you, has been like a very ongoing journey. I really appreciate hearing about how those things have changed over the years through diagnosis and treatment. I'm wondering, so with your specific conditions, what this might not fully apply, but I'm curious what sort of challenges you guys may have faced either in the healthcare system. Stephanie, you mentioned some of these early on with getting diagnosis when you were super young, but also outside, like have you had to ask for accommodations either in education or workplaces, and have you faced challenges in those areas?
At the time I was experiencing the most symptoms, so like middle school and high school, I actually missed about 2 years of high school in total, out of the 4, which Shani probably remembers. um, it wasn't constant. It wasn't like I missed 2 years all at once. It was me missing on and off like throughout the 4 years. So about a semester each year is what it ended up being. The difficult I do have to say that being chronically ill and going through this in addition to another chronic illness or two I have, schools do not like giving accommodations unless you have a diagnosis, which makes it very difficult to get help. So it was hard. Teachers were generally pretty flexible with, making up work and, getting things done, but it opened my eyes to a lot of systemic issues that we have, because it also highlights how important having a diagnosis can be in order for people to get help. It's unfortunate that there's not a lot of safeguards in place for people who are undiagnosed going through a lot of health issues to, get the help that they need, especially when we're talking about kids. Like I was a kid, like I was not an adult. It was very frustrating, and I thankfully had very supportive parents. My mom was very active in speaking up for me when I needed help, because again, it's kids versus adults in the school system. So having that support was a major, major help. Uh, I don't need any accommodations for it now. As I said, I only really experience pain like maybe every other month for a few hours here and there. Like it's really not bad at all, which I'm very thankful for. But before that, it was not that way. Um, it definitely highlights that having a diagnosis is powerful, which is kind of the whole reason why we wanted to start this nonprofit in the whole place, was to bring attention to the fact that these things exist and we need to talk about them more because more people need to know about them, and hopefully help people get diagnosed earlier so they don't have to go as long without the help that they need to, live their life normally.
Yeah, I definitely, luckily, haven't needed accommodations in a workplace or a school setting, but I can definitely speak to what Stephanie was saying about advocating for yourself, whether that's in everyday life and even just talking about, living with this condition, and also more importantly for me, within the healthcare system. I think, um, I'm sorry, I lost my train of thought there. Um, a lot of the stuff that I went through was more social and emotional, and self-identity based. It was looking internally and trying to undo like mental work about what I'd been socialized to think life as a woman should be like. And of course, not placing any blame on the women in my life or the female medical professionals that I've seen to and spoken to, but there was always this undercurrent of, like not invalidating your symptoms, but hey, we all go through this, like it sucks, but push through it. And at some point things will level out. Maybe when you have kids and your body changes, then things will level out. When you go through menopause, things will change and it'll all go away. And that to me just wasn't satisfying enough of an answer. At some point, I was like, I know what my body's going through, and I know that there has to be more that I can do. So I think I was lucky in the fact that I was an adult, mostly when I was going through some of this, so I was able to be more informed and stand up for myself and push back on some of the rhetoric that I was getting. I wouldn't say that I had notable negative experiences with healthcare professionals in that regard. I think it was more like genuinely working through stigma and information like together. Like I felt like it was a very collaborative process and I was appreciative of that, and at least getting somebody to take what I was going through seriously and order the right tests and explain to me, what Rotterdam criteria are and give me these very actionable steps to take to make my life better, to make me feel better mentally and emotionally as well. So, yeah, that was kind of my experience with that.
You made me think, something you said made me have more thoughts. First and foremost, the thing about, oh, once you have kids, it'll all go away, like it'll level out. If I had $1 for every time I was told that, I wouldn't have that many dollars, but like I'd probably have like 20. But it's first and foremost, not every woman wants to have biological children. I don't think that should be a standard that people fall back on, being like, oh, it'll level out once you have kids. It's like that's talking about, again, like the expectations on women in general or people with uteruses just to have kids because you have that organ. I love kids. I do want to have kids someday, but not I'm not going to give birth. Like I'll adopt. I'll find other ways to have kids in my life, but due to some other chronic illnesses I have, it's just not an option for me, unfortunately. Wouldn't necessarily be my choice, but it's kind of a forced choice, if that makes sense. But having kids will not. That's a really common misconception with endometriosis. It's like there are some women that do, once they do give birth, they have less issues with endometriosis and it kind of goes away for them. That's what happened to my mom. My mom had endometriosis, so it does run in my family as well. And she fortunately did not have any issues after she had me. So I guess that was my gift to her. She gave me life. I gave her no more endo. But it doesn't happen to everyone. It's not super duper common. It's common enough to have that association, but the vast majority of people don't have that happen to them. And having that is harmful. I had another thought. I don't remember what it was. I'm sure I'll speak on it at some point, but yeah, I just wanted to say that.
No, I appreciate that. And I think that both of you really emphasize the point of how important like advocacy and just being able to have that back and forth with medical providers, with the medical team, how important that is. Stephanie, you touched on this a little bit, but our next question is, what's a misconception about your condition that you've encountered and how can we challenge it?
I will think on that more, but that kind of is the misconception that sticks out in my head the most. So Ishani, if you'd like to go.
I think for me, in my experience, first of all, a big misconception does revolve around that Rotterdam criteria that you touched on earlier, Prabnor, is that PCOS only means physically having polycystic ovaries. That is a form of the disease, and many women who are diagnosed with this do end up meeting that criteria, but not necessarily true for all. And getting an ultrasound can be an invasive process for some. So relying just on that anatomical aspect of things, or assuming that that is the only form, the only presentation of PCOS, I think is definitely a misconception. As far as challenging it, I don't know if I can answer that question fully. I guess just recognizing that there are other signs and symptoms, and generally when it comes to PCOS, a lot of those manifestations are different physically versus just you, like I can't feel cysts in my ovaries, for example. I can feel weight gain. I can feel excess hair. I can feel, not having a period. Tracking my cycle, things like that. So if you're someone who's suspicious that you have PCOS, I guess a way to challenge that misconception is to be very present and aware of your body and kind of keeping track of those symptoms and how you feel, especially at certain points in your cycle, if you have one, keeping track of your cycle in the first place and pinning down exactly how you feel in a way that you can talk to a medical professional about. And that really helps bridge the gap between, because a patient's medical history can be very subjective and can be very vague and abstract. And that's what it's meant to be. It's just meant to be how you feel, right? But if you pay attention to that and just try to speak about what you feel physically or see physically going on in your body, I think that can go a long way towards recognizing PCOS earlier or in different forms rather than just that one test and that one anatomical presentation, if that makes sense.
I think that's a really great point. You speaking on that also made me think of, like, we're challenging it kind of every day in our lives just by talking about it, being open about it, bringing awareness to things in general, just so more people know that these things exist the way they do. I think challenges the misconceptions. It's like, no, that's not correct, and we're going to talk about it, and here's why. That's a really major factor. You also made me think about just going through keeping track of your symptoms and having kind of like a physical way of showing a medical professional, this is what's going on with my body, is also a very big thing. You're generally taken more seriously when you do have stuff like that to back you up. So if you are questioning if you're experiencing some of these things, I'd highly recommend, like Ishani said, keeping track of your symptoms, keeping track of what's going on with your body on a day-to-day basis is really important. I literally went to the dollar store and got like a mini calendar for myself that's purely, this is my medical symptom calendar. This is what I'm feeling every day. This is what I'm bleeding this day. I'm not. It looks like this. It's whatever. I actually, at one point, this was, oh gosh, I think it was like senior year of high school through like freshman year in college. I was bleeding literally every day. Like it almost was 2 years. Like my friends were prepared to throw me like a period party at the 2-year mark, being like, we're gonna celebrate, we're gonna have red velvet cake, it's gonna be a great time. And I didn't make it to that. And it was really funny. At the time, it's funny laughing at it now, but like it's just our bodies are wild, and keeping track and having that kind of, it's not really proof because you can't prove it, but you keep track of stuff so you can talk about things with your doctor, is kind of the whole point there. But that also made me think of my other thing I was going to say about talking with medical professionals about this. It's don't settle for, if you don't have to see the same doctor if they're not helping you and if they're not listening to you. I hate the term doctor shopping, but you kind of have to do it to get help sometimes, and it's not a bad thing. You're just looking for someone that's willing to help you and listen to you, because you don't have to settle with dealing with a really abnormal amount of pain or any symptoms that you're dealing with, really. It's kind of weird, but like I said earlier, I no gynecologist wanted to touch me when I was 14. They were like, nope, you're too young, whatever. I actually went to my mom's gynecologist. That's the only person who would see me. And he's actually the person, well, my mom obviously birthed me. He's the person who assisted in that birth. So it's kind of weird. He's known me since literally day one. And it's, we've kind of had a love-hate relationship along the way, because he wasn't listening to me at some points in time where he was like, yeah, primary dysmenorrhea, like we'll look at other stuff when you get older. And, you know, he wouldn't order an MRI for me, because that's some way you can kind of get an indication for some endometriosis. It's not an official diagnosis, but sometimes it can be seen on MRI. And he's like, no, your ovaries are shut down. Like you're not going to show anything. We won't see anything. So I went to another doctor. I got my MRI. I came back to him with the MRI, and he looked at it. He's like, oh crap, your ovaries are not shut down. And I'm like, yeah, I could have told you that. And it's, you know, but I went back to him because I do trust him and we do have a good relationship. It's just, we did a lot of learning together on these things, and he listens to patients a lot more now. I actually did end up shadowing him for some period of time, and he's like, your case kind of made me think about things differently, which is good and bad at the same time. You know, you don't want to be hearing that, but at the same time, I'm glad that he's being more receptive to things and, you know, taking what he's learned and applying it and changing and helping more people. But it's okay to, you know, advocate for yourself and get the tests that you want to get done to show things that you need to show, because you know your body best. You're your own expert in your body. And if you feel something's wrong, something's probably wrong. So just trust yourself in that.
Yeah, I wonder if you guys would agree with like the general impression that I've gotten from a lot of gynecological conditions and talking to people with them, is that like a lot of these base misconceptions that are kind of across the field of no matter which condition you have are really based in the idea that that either this pain is normal, or that you don't know what you're talking about, you don't know what you're feeling is, which I think is unfortunately very common across a lot of these illnesses. So thank you for sharing those specific experiences. I do think we might have gotten a little bit of ahead of ourselves, because their next question is, what advice would you give to someone who is newly diagnosed or suspecting of having your condition? I know you guys already touched on symptom tracking and advocating for yourself with doctors, maybe a little bit of doctor shopping. Are there anything else specifically, especially like maybe emotionally, that you would want to say or recommend for those who are experiencing what you were a few years ago or 10 years ago?
I do have something actually. And I think Stephanie really expanded on her experience really nicely and made a lot of great points. Emotionally, I think, and this applies for any, especially invisible illness, that the anxiety is going to be thrown at you a lot as a description for what you're going through and as the root cause of all of your symptoms. Or maybe you have something going on, but anxiety and stress is making it worse. What I would say to that is yes, and um, yes, it's a very stressful process to go through. It gives you anxiety. It gave me anxiety to know that something is going on in my body, something is changing, something is wrong, but I'm not able to put a name to it. I'm not able to treat my symptoms. I'm not able to feel better. And that cycle can be pretty vicious of, you know, you have a condition, you have something wrong with you, it stresses you out, the stress exacerbates your condition, and around and around and around and around. What I would say to someone who suspects that they have a gynecological condition of any kind, I think especially, yes, women's health, this that don't let a medical professional tell you that everything that you're feeling is up to anxiety. It's part of it, yes. Stress is a part of it, yes. But advocate for physically what you're feeling, going back to symptom tracking and all those other things that I talked about a little bit and Stephanie did as well. And if you're not 100% satisfied with the answers you're getting, and especially if you feel like you're being talked down to, or somebody's being condescending towards you because you're younger or you're a woman or whatever else, feel free to go and get a second opinion. Any good doctor will tell you, and I say this in my experience working for two great medical providers, they will tell you, yes, go seek a second opinion, do what's right for you, get all the information you need to feel comfortable with what you need to do next. So I would say definitely pay attention to how you're being spoken to and how you're being treated, in addition to the actual treatment and the medical advice that you're being given. And it's not a like it's not always a gender thing. I have a dermatologist, endocrinologist, gynecologist, a GP, like everything. And I worked with great male and female providers before. So it's not that only women can understand gynecological conditions. So that's not necessarily true. They may be more understanding of what you're going through, or more, emotionally, physically connected under of your symptoms and your experience as an AFAB person or a woman. But like, if you find the professional that's working with you and you're happy with that and they're treating you, then like that's absolutely fine. It's just a matter of finding the right balance of somebody who respects you as a patient, as a person, and is treating you and giving you good medical advice.
For sure. I think you said that very nicely. The anxiety thing is definitely a major thing too. Ironically, that's actually how I got accommodations in high school, is because they diagnosed me with anxiety for all of the pain I was experiencing. And I'm like, you know what? That's a diagnosis. Let's go get accommodations. So I did use that to help me in high school to, get what I needed while I was undiagnosed with endometriosis. But yeah, it's not all in your head. You're not crazy. That's a lot of people get that response, which is really unfortunate. What was the original question? It was, again, sorry.
No, you're so fine. What advice would you give for someone newly diagnosed?
Give yourself time to feel all of the feelings that you feel. It can be different for different people. For me, getting a diagnosis was really relieving, and it was like, great. I'm so happy that I'm not crazy. I wasn't making it up in my head. This is actual proof now. Some people, I did spend some time also grieving the fact, like, yeah, this is, something that can't be cured. There isn't a cure for it. I have to deal with this probably for the majority of my life. It probably won't go away. Just feel what you need to feel. It's okay. Talk to someone if you need to talk to someone. There's great communities of people online that are dealing with similar things that you're probably dealing with. Also, just talk to your friends and family. Getting people on the same page that you are can be really helpful, even though they might not be experiencing it themselves, but just letting them know, like, hey, I'm not feeling too great today. Just having emotional support is really important, like Ishani touched on. It's just, you know, this is your life. You have to find a way to live with it and be keeping an advocate for yourself. Trust yourself is the best thing you really can do.
Yeah, definitely. I think just hearing both of your responses, I feel like the emphasis on agency, whether that's like talking to your doctor and having that sort of back and forth collaborative relationship you were mentioning, Ishani, or even with your friends and family, just being able to advocate for yourself that, like, this is what I'm feeling today, like, this is what I need. And obviously it takes time to get to that point. It takes time to really understand what you need yourself and be able, like, understanding is one thing, but then like actually being able to vocalize it and advocate for yourself is like a whole nother thing. So obviously that's also definitely important to keep in mind. So thank you. I guess for our final question, since we have like 10 minutes left, I know we've talked a lot about talking to medical providers and that relationship, but if the public were to know one thing about your condition, what would you want it to be?
I think I'm going to rely on a fact here, which is not the only thing I want people to know, but endometriosis approximately 10% of it's like 1 in 10-ish people are estimated to have it, which is a lot. Like that's very common. Um, so it's don't just be compassionate and try to, you don't have to understand people, but just be kind and know that a lot of people are dealing with things that you can't see. And if you take all of these invisible illnesses that we talk about and add all of them up together, like, oh, well, 1 in 10, well, 1 in whatever, that's a lot of people. It spreads across a lot of different people. And just, it's common. It's okay to go and try to seek help and just be kind to other people.
Yeah, I think Stephanie wrapped that up perfectly. That's definitely a sentiment that I would love for the public in general to know. And the other thing, I guess, from my perspective, would be that you should know that if you see me on a good day, I'm grateful for that good day. And I don't always have a good day. And some days are worse than others. And that goes along with what Stephanie was talking about, being compassionate. But having an illness, having a chronic illness or disability doesn't mean that you see every symptom every day, every manifestation every day. You have incredible days and you have horrible days where you're bedbound and you can't move and you can't talk and everything hurts mentally, physically. So I would for people to know generally about invisible illness that people who go through this, we're grateful for every good day that we have, and we're happy that everyone in our lives gets to be a part of that good day and the bad days too, but it's not 100% of the time.
Yeah, that really falls back to, we talk about dynamic disability a lot. It fluctuates. Days are not consistent. That's, well, first of all, that's kind of what a menstrual cycle is. When we're talking about gynecological conditions, every day is a little bit different. But it's, just because you can see me do something someday doesn't mean I'm going to be able to do it tomorrow. It's all about feeling out your body, seeing what you're capable of doing, pushing yourself appropriately, and knowing when to stop. And it's very individualized, and that's why we always talk about how someone can have the same condition but be experiencing totally different things. So just keep that in mind when you're talking about things too. It's like, well, I know someone that has this condition and they don't do XYZ, and it's like, okay, cool, good for them. This is me that we're talking about too. It's like everyone's a little bit different, and which also makes it difficult, I think, for medical professionals too, because it's like they see the same conditions all the time, but different presentations of it. And having such a wide variety of things can be confusing and hard to pinpoint, especially when Prabnor did the presentation a little earlier. The common symptoms of adenomyosis and endometriosis are very overlapping. Same with PCOS too. It's like pain, fatigue, more pain, cramping. Like it's just they overlap a lot, and it's really hard to pin down what something is specifically. But that's why it's so important also to have a compassionate medical provider that wants to work with you and collaborate with you and is willing to grow with you, like mine was. It's like, it's a journey, and you need to find someone willing to take that journey with you. And yeah, that's me rambling at this point, being like, yes, primary care, we love it. We love to see it. We need more primary care providers that are good. So yeah, that's.
No, definitely. Thank you so much. Thank you both for sharing your experiences and really emphasizing the point that everyone's experience is unique. Like we mentioned at the beginning, two people are experiencing the same thing, and that's something we really want to be respectful of. So thank you so much. That's kind of the end of our formal questions. But if anyone has another question or has something to add, or if we couldn't cover anything, this is a great time to do that. If anyone wants to put anything into the chat, or you can unmute and ask, but
I kind of thought of something. I'm gonna yap some more, but we talked about advocating for yourself a lot. I do have to say I also advocated for myself even once my doctor agreed to do the surgery and we got to that point and I'm like, yes, we're gonna get an IUD. He actually tried to convince me to do, I actually have a small uterus, like not abnormally small, but like just small. And he thought the Mirena was gonna be too large for me and it was gonna just cause pain just by being in my uterus. And he was pushing me to do the Kyleena. And my main concern with that was, well, what if it's not, it has less hormones associated with it because it's smaller, it's not as strong per se as the Mirena. And I'm like, you thought my ovaries were shut down and they were not by the birth control, which they should be by oral birth control, they should be shut down, but they weren't. Let's do the stronger one. Worst case scenario, you take it out and then we put the smaller one in. But you have to wait like 3 months or so in order to kind of see if it's going to be working. And my concern is, what if it's not enough and I'm just going to be in pain more for another 3 months? So I kind of advocated for myself in that way and pushed for that. And it worked out great. I have no problems. It's like, it kind of goes back to, you kind of know your body best and do your research and be educated yourself too, because medical providers can have the right intentions in what they're trying to help you with. But again, you know your body the best. They're not living in your skin. They don't have to deal with the symptoms of how they're helping you treat your condition. You are. So it's okay to push back a little bit and, kind of collaborate and be like, advocate for yourself. Just speak up on, this is what I think is the best option. Here's why. Hear me out. And he ultimately agreed with me and he was like, that's a good point. Yeah, well, we can always do it backwards too. So there's a lot of different treatment options for these things. Most of them fall under the category of birth control for gynecological conditions, but just it's okay to try different things and work it out.
Thank you. If anyone has any other questions, but in the meantime, just quick information about our social media. Once again, we have our Instagrams right here, as well as our website. And then if you want to scan this QR code, it'll lead you to the link tree to get information about our events calendar and our newsletter. But otherwise, thank you, Stephanie and Ishani. We really appreciate it.
Thanks for having us.
Thank you. Yeah, I'm glad that I could be part of this and share, and hopefully the right people get the right things out of this. And it's nice to spread awareness and talk about something I think can feel pretty intimate. Obviously, any diagnosis, talking about any health condition is intimate, but I think specifically gynecological conditions can feel stigmatized and it can be hard to talk about. So I'm happy to share my experience if it's going to help somebody else.
Yeah, I couldn't have said it any better. Ishani has been great tonight, much more succinct than I am and has more sorted out points. I feel like I rambled a bit, but yeah, essentially what Ishani said. It's definitely a more intimate topic, and I think that's also part of socially how we were raised too, is like, oh, don't talk about your period, don't, girls go through it, it's fine, but speak up about it. Like, it's not a taboo thing. Half the population goes through what we're going through in some capacity, so it's, the more we talk about it, the more people know about things, the more awareness is spread, and the more help people get.